This is a general disclaimer. Redlands Community College attempts to have the most accurate and up-to-date information listed in its content and delivery. However, your education is your responsibility. Redlands Community College or Roy Smith makes no guarantee in the accuracy of this information in this video and accepts no liability for the informational video. The information expressed is strictly the opinion of the author and the presenter, which is listed in the reference near the end of the video. This information is designed to supplement your own education or initial education and should not be used to replace any current academic program you're enrolled in. View the information and content at your own risk. Thank you.
This is going to be Chapter 30, Anaphylaxis. Key concepts. Upon completion of this chapter, you will understand that anaphylaxis is the most severe form of an allergic reaction, how the anaphylaxis is mediated by the immune system and the complement system to cause the inflammatory response, the emergency medications that support blood pressure, promote bronchial dilation, and decrease capillary permeability. Chief concern. Allergic reactions. They occur after you have been exposed to an allergen. Common agents that cause allergic reactions are medications, insect bites, stings, and certain foods. An immune response is composed of a complex cascade of events designed to destroy pathogens and foreign bodies as they enter the body. And immunoglobulins are involved in that, and there are several of them. There's IgA, IgD, IgG, and IgE, and IgM. As far as antigen goes, the immunoglobulin IgE plays a key role in an allergic reaction. So, IgE. Histamines. There are complexes that trigger the release of histamine from mast cells, a type of immune system cell that is present in the tissues, and whenever a mast cell degranulates, it releases histamine, and this causes vasodilation. Now, if we exponentially increase this to where we have a systemic release of histamine from the mast cells, then we can have vasodilation systemically. Associated symptoms of this that we see are urticaria or hives and wheezing, throat, limb, and facial swelling. And figure 31 is urticaria, which we're going to look at. I'm going to clear the IgE off, and these are all reddened spots that are raised if you feel them just a little bit. So as you run your fingers across them, they'll be a little bit raised. Urticaria is what it's called. And they're hives. This is from a cellular-mediated version of vasodilation that caused a leaky system and caused histamine to degranulate from the mast cells in this area. And the more that these spread around the body, the more systemic the anaphylaxis becomes. Chief concern, continued. We see other conditions with similarities to an allergic reaction, one of them being chronic obstructive pulmonary disease. And that would be from the shortness of breath. Asthma that will also give us wheezing, and aspiration that will also give us wheezing due to foreign body actually within the lung tissue. Airway obstruction can give us decreased ability to bring in air. And then angioedema usually involves significant swelling. Angioedema is of the lips, face, upper airway, tongue, and may also include the digestive tract. Bradykinin, which is in this section as well, it's a term, a chemical that serves various functions. However, its most important function is as a potent vasodilator. And we're going to look at figure 30.2, and this is a patient that has angioedema. If you'll notice how large the tongue looks, and that's because if this is dangerous for the patient, because if the tongue completely occludes the entire airway, then the airway itself, the only input that you're going to have to the upper airway is through the nair. So trying to intubate this person with a tongue this large would also be problematic as well. History. Patient appears distressed. Begin treatment during the history taking. If you can get information from family members, use family members as well. Consideration. Start with some open-ended questions. So what's going on today? And then some focus questions as they start answering. Exposures, any kind of new medications that they might be on, any kind of foods that they've eaten, any kind of insect stings. Try to remember the ample mnemonic when going through this. It will help you get through the history questions a lot easier. Examination, initial airway evaluation is very important. Look for obstruction or potential obstruction. Consider breathing assessment, respiratory rate, work of breathing, use of accessory muscles, and breath sounds. Signs of any kind of circulatory compromise, things like tachycardia and hypotension. Just take a good long look at that and recheck them frequently. That way we can see any kind of trending. Vital signs, investigate any kind of abnormalities or red flags that you come across. Cutaneous manifestations like erythema, redness, or urticaria and hives and edema. Inspect their face, neck, hands, and or feet as well for signs of swelling. Signs of poor perfusion, and this would be things like altered mental status, diaphoresis. You can't beat the physiology, so at the point that the patient shuts the precapillary sphincter and shunts towards the core, sweat would be released from the sebaceous glands to facilitate this. Cool skin, delayed capillary refill. Remember that 3 things make up blood pressure. That would be heart rate, contractile force strength, and peripheral vascular resistance. And I'll just make this nice and simple. That peripheral vascular resistance with a systemic release of histamine may not be possible. So as the vessels continue to get larger and larger, the hypotension gets worse and worse. You need to get ahead of that as soon as possible. Assessment, working through potential diagnoses. And very quickly we need to exclude these other potential diagnoses like COPD. Do they have a possibility of an asthma attack or bronchospasm along with this? Is there any type of airway obstruction? With anaphylaxis, wheezing and urticaria narrows your differential diagnosis. At the point that they have hives, that should assist you in narrowing your clinical findings. As far as treatment, first priority is going to be airway, breathing, and circulation issues. Any kind of hemodynamically unstable patient, we need to provide them with IV access, fluid administration, and positioning. Medications like epinephrine are the drug of choice in the treatment for anaphylaxis, and that's because it's a sympathomimetic medication, or I mimic the sympathetic nervous system. It causes bronchodilation, peripheral vasoconstriction. So for those vessels that are very large and leaky, the epinephrine kind of constricts them down and solves, it's the symptom solver, if you will, and increases the blood pressure. Antihistamines that would be given block the histamine receptor site in the body and limit the body's natural response to histamine. And then corticosteroids would be our last, like Solumedrol, suppress the immune system and result in decreased inflammation. Clear this off. Upon evaluation of the patient, we should reassess them frequently during transport, their airway, breathing, circulation, and vital signs. Any type of lost containment whatsoever, we should really look at utilizing epinephrine or utilizing higher doses of epinephrine. And what I mean by that is if we started off with a blood pressure of 130 and then halfway through the transport, the blood pressure is 70/40. If we think, or there's a preponderance of evidence that suggests that anaphylaxis was the cause of this, we need to find those clinical indications and facilitate treatment quickly. Note response to any medications during transport as well or evaluation, and continue monitoring the patient. Disposition, allergic reactions, or anaphylaxis, you can transport them to the hospital, especially if you got ahead of the actual pathophysiology that's present. Potential airway problems or anybody that's hemodynamically unstable, quickly transfer them to the closest appropriate medical facility or per your local protocol. In conclusion, allergic reactions are an example of the immune system overacting to an allergen, whether it's food, a smell, contact with another substance. It can range from non-life-threatening to and bothersome rash to full-blown anaphylaxis or shock. Death may be averted if the paramedic responds aggressively to any type of severe allergic reaction. References for this lecture were taken from Myers, Professional Paramedic, Volume 2, Medical Emergencies of Del Mar Learning. And if you have any questions concerning this chapter, feel free to give me a call. My name is Roy Smith, roy.smith@redlandscc.edu or 405-219-7613. Thank you.